future nurses, welcome to Prioritization Question Breakdown. This is one of my favorite things to teach. I really think it helps my students better understand how to break down an NCLEX-style question. And this is also one of the most frustrating things about nursing school. You have questions where all answers are correct. So how do we teach you to get to the best answer? And how I like to think about these questions is they are just trying to facilitate critical thinking. It is very hard to teach critical thinking. It's something you will develop through your nursing career, where you can walk in that room and you can just see with inspection that your client is off. Or you can start seeing a picture or a potential problem or a right here, right now problem just with your instincts and your assessment data. So I really think these questions are trying to help facilitate critical thinking, which is something you will continue to develop throughout your whole nursing career. When I talk about prioritization questions, I really want you to understand that there are some key words in these questions, meaning, again, that we could potentially have all correct answers, but you want the best answer. So in questions, if you see keywords such as first, best, most, priority, you really need to think, I could have multiple right answers and I'm going to pick one. So I want you to think, I have a scenario, because a lot of times they're in scenario-based styles, and I'm going to walk in that room and I'm going to perform one answer choice for this client and I'm going to leave. You're not going to do one answer choice and then follow it up with another answer choice. You're going to do one answer choice and leave, and you've kept that client in the best state possible. You've kept them alive and you've kept them safe, okay? So if you have not already reviewed my nursing process video and my Maslow's video, please do so before watching this video. It'll really help tie it together for you. So if I were a nursing student, on my paper or on my scratch paper, however you take testing at your schools, whether it be paper or electronic, I would always write down my nursing process and how I view Maslow's as a nurse. Because when you think about these scenarios, we as nurses can only act in ad pi. Meaning, if you have no assessment data, you cannot implement. You have to collect data before you take an action. Because if you're just taking action, there's no data to support your action, you're not following your nursing process. And always we pick according to Maslow's. So Maslow's meaning, based upon the data that is presented to us, we are going to pick what would hurt the client the greatest, or what would kill them first, okay? And then the last thing I want you to keep in the back of your head, when we are talking about diseases, a diagnosed disease, if it says in a scenario, the client with COPD, well, in this NCLEX perfect world, we already know they have this disorder. There are typical manifestations that present with this disorder, so are we really going to run to those every time? Because think about it, in this perfect world, if they're already diagnosed with it, aren't we treating it appropriately? We've already diagnosed them, meaning we've already gathered data to support this diagnosis, this medical diagnosis, and therefore they're treating them appropriately in this perfect world. So when you start getting to your diseases, or what is most important to report to the healthcare provider, I really want you to think about manifestation versus complication. Why would we report a manifestation of a disease when we already know the client has this disease? You need to look for complications, or expected versus unexpected. Why would we report things that are expected to see in this scenario? For instance, a 30-minute post-operative client, you know, if they've had general anesthesia, it's expected to have a sore throat. If they are coming out of general anesthesia, it's expected that they might not be alert and oriented ×4 until all of the anesthesia wears off. So think about expected versus unexpected for scenarios. You always want to go towards the unexpected because we don't know why this is occurring. This is something we're going to have to look into further. So just bear with me as we break down questions. I've given a lot of scenarios. What do we do first? What is priority to report to the healthcare provider? And then also, who do you see first? Okay? And again, when it comes to tackling prioritization questions, make sure you have a systematic way of breaking it down. And also, the more questions you do, the better you will get. So whatever question resources you have out there, take them over and over and over again so you can just see. Don't just take the question and see that you got it wrong. Take the question and understand the why behind it. Why did you get it wrong? Or why did you get it right? Make sure to read the rationales as well. Let's start with the first question. The nurse receives a 4-hour post-operative client from the post-anesthesia care unit. What action does the nurse take first? So our key priority word is in there, and it is a scenario. So first, step number 1, identify the topic of the question. The nurse receives a 4-hour post-operative client from the post-anesthesia care unit. What action does the nurse take first? My topic is post-operative client. They are only 4 hours out, and what do I do first as a nurse? This is a scenario. So the first thing I'm going to think about in my scenario is my nursing process. Do I have any assessment data? I have no assessment data on this client. They give you scenarios, and when it says the nurse, you need to assume you are that nurse. So, no assessment data at all. If I have no assessment data, it's going to red flag me to start the assessment, to gather data on this client, because I need to perform the first step of ADPI. So I put a little X, thinking in my brain, I have no assessment data. And your topic is a post-operative client. What do you do first? I better assess something according to my post-operative client, and it better always be according to Maslow's. So let's label our answer choices. Orient the client to the unit. That means here's your call bell. Here's your remote control. This is where your TV is. This is where your bathroom is. Making them comfortable to the unit. Is this assessment or implementation? Meaning, are you gathering data or are you putting an action into place? This is implementation. You are showing the client around. You are orienting them to their room. So this cannot be our answer choice off gate because it's an action, it's our intervention. So let's keep looking. Review the physician's order. Reviewing the physician's order is collecting information. You need to see what is ordered for the client. So I would mark that as an assessment. Obtain vital signs we know is an assessment. Remember, it's just gathering data. And auscultating bowel sounds, assessment. So off gate, I can get rid of the first answer choice because that's an action. Because we know we have not assessed our client at all in this scenario. And let's label our answer choices according to Maslow's. Review the physician orders. Does this do anything for their physiological well-being in terms of assessment? Have we done any type of assessment for their body? No. Have we reviewed physician orders? Does that put your hands on your client? Does that put your stethoscope on your client? Does that see your client? No. So, in terms of prioritization, you always better go to your client first before going to a chart or to lab values or to a diagnostic test. You need to see your client. That is prioritization. So, according to Maslow's, I am not going to go to a chart. I'm going to go to my client first. So, I'm going to get rid of this answer choice. And let's see, obtain vital signs. What is included in that in terms of Maslow's? You can see heart rate and blood pressure, so that can show you circulation. You can see respiratory rate and pulse oximetry reading, which can show you breathing. So this is showing you a lot according to Maslow's. Circulation, breathing, you even have a temperature, which can show you risk of infection. So hold on to that. That's a good answer choice. And auscultating bowel sounds is an assessment answer, but what are we looking at? The only topic for auscultating bowel sounds is GI. We are just trying to see the motility. Is their peristalsis working in their abdomen? So between these two assessment choices, even though they're both physical, I would go with obtaining my vital signs because it would give me more data and it's higher on your Maslow's list. All right, so let's look at the next scenario. The nurse is caring for a 4-hour post-operative client. The client's temperature is 102.5 degrees Fahrenheit. Heart rate is 132 beats per minute. Blood pressure is 84/42 millimeters of mercury. And their skin, I apologize, it's supposed to say, and their skin is cool and clammy. What action does the nurse take first? You see that keyword, meaning again, in the real world, we do all these answer choices. But you're going to think, I'm going to walk in that room and do one thing and I've kept my client the safest. So, in this scenario, you have a lot of assessment data. So, what you need to think about in your assessment data, if we have collected enough data that shows us a clearly identified problem, you are to collect no more data. You are to go on in your nursing process and act. Because if you collect more data and they already have a clearly identified problem, you're wasting time. So let's start identifying the topic. So again, 4-hour post-op client, right? And let's look at all this data. Elevated temperature, elevated heart rate, low blood pressure, and the skin is cool and clammy. A lot of data going on here. Now let's see if we have a clearly identified problem. High temperature, can we act on that? We could give acetaminophen and bring that fever down, absolutely. So when I'm thinking about an elevated temperature, I'm thinking about risk of infection as my topic. You can have multiple problems in a scenario, but the one you're going to act on is the one that is highest in priority according to Maslow's. Okay? So high heart rate, low blood pressure, and skin is cool and clammy. This is showing us another clearly identified problem. This is showing us a circulatory problem. Your blood pressure is low and now your heart rate is trying to pump faster and faster to try to cope with that low volume in your body. And now skin is cool and clammy. Well, our blood could be shunting to our vital organs. We don't care about perfusing our skin right here, right now, if we have depleted volume in our body. We're going to try to shove that volume, which transports oxygen, to the organs that matter most. It's not your skin, it's your heart, it's your lungs, it's your brain. So that's why their skin can be cool and clammy. So when we put all this data together, it's showing us a clearly identified circulation problem. I don't like for y'all to medically diagnose. We're not physicians. But we can absolutely understand that they have fluid volume deficit as shown by low blood pressure, high heart rate, and cool and clammy skin. And we know how to act on fluid volume deficit as nurses. So what I like to do is put a check mark. I have a clearly identified problem, and my clearly identified problem is circulation. So I am going to find a circulation intervention, okay? So let's read our answer choices. Assess. Keyword, always already telling us that we're assessing. Do we need to gather more data right now? No. We need an action that helps circulation. So administer acetaminophen. This is an implementation or intervention, so hold on to it. Auscultate heart and lung sounds, another assessment because we're gathering data, and administer fluids, an intervention. Well, I know I can get rid of my assessment. I have a clearly identified circulation problem, so I need to act on circulation to help this client the best right now. So get rid of your assessment, and let's look at what each one is addressing, the topic. Administering acetaminophen will not help the circulation. It would help the risk of infection. Administering fluids would absolutely help your circulation because that's a circulation intervention. So we have found our answer choice. I want to change this up just a second so you can see how NCLEX-style questions can change just with a couple more words added in. So really pay attention and always think of your patient as a different patient each scenario, okay? So I'm going to erase these and I'm going to add something in here. And it's going to completely, forgive my blue, I didn't grab my black pen. It's going to completely change my answer choice. So we're going to leave the nurses caring for a 4-hour post-operative client. I'm going to insert the UAP. UAP stands for Unlicensed Assistant Professional, or the CNA, your Certified Nursing Assistant. If this question had said the UAP or the CNA reported to the nurse that the client's temperature is 102.5, that the heart rate is 132, that the blood pressure is 84/42, and that their skin is cool and clammy. All I have to do is insert one thing and it completely changes this question. The UAP or the CNA reported all of this data. So let's think about that. Did you, the nurse, gather this data? Did you start your first step of your nursing process? No. So just inserting that, the UAP or the CNA, or the wife reports. Do you understand that's all subjective data? We haven't gathered our own data yet as nurses, and therefore I will not act on somebody else's data. So just inserting that would change my scenario to an X, because I, the nurse, have not done the first step of my nursing process and collected data. So even though you have all this information, you didn't collect it, and you didn't start the assessment step in your nursing process. So when we're looking at our answer choices, you have to gather data, and you have to gather according to Maslow's. So we will be looking for an assessment answer choice. So assess, implement, assess, implement. Get rid of your implementation because, again, you haven't started the first step of your nursing process. Assess pulse oximetry reading could show breathing. And then auscultate heart and lung sounds could show circulation and breathing. Both are very, very important. And I actually wouldn't like to pick if I could do one thing or one thing only. But if I had to walk in that room and only do one thing, I would put a pulse ox on my client to see if their oxygen was low. So we would assess a pulse oximeter reading versus listening to lung sounds or auscultating the heart to try to identify maybe arrhythmias or abnormal breath sounds. But if we have low oxygen in our blood, we can try to act quickly by putting oxygen on our client. So do you see how inserting information can change the whole scenario? Always remember, you have not completed the first step of assessment if it's secondhand information. If the UAP reported it to you, if the CNA reported it to you, if the wife came to the nurse's station. So the first step you should be looking for is an assessment answer. Let's continue and look at another scenario. So the nurse is caring for a client with chronic obstructive pulmonary disorder. What is priority to report? And typically your question says, what is priority to report to the healthcare provider? So we know we have that keyword because in the real world, if we had all these things, we would check them out. We would ensure our client's safety. But remember, if you can report one thing and one thing only, you're going to report what is showing the most severe problem, okay? And I want you to see, remember I talked about manifestation versus complication, or expected versus unexpected. You have a topic, and your topic is a disease. So, COPD. What we are going to report to the healthcare provider is not going to be a manifestation of this disease. It is going to be a complication, or something that is not expected to happen with somebody who has COPD. So let's read our answer choices. Dyspnea on exertion, meaning they have difficulty breathing with activity or while they exert themselves. Let's say they're bathing themselves or getting dressed. Is this a manifestation or complication of COPD? It's a manifestation. So would I run to that if I saw that occur? No, because it's most likely to occur because we know they're diagnosed with this disease, and in this NCLEX perfect world, they're being treated appropriately for the disease. Pulse oximetry reading of 90% on room air. Is this a manifestation or complication of COPD? We know that COPDers, their drive to breathe is not like us healthy adults. Their drive to breathe is manifested by low oxygen levels. So, This is very typical of a COPDer. Would we necessarily run and even administer oxygen to them? No, a lot of COPDers sat right around 90%, 91%. And remember, we'd never put high flow oxygen on them because it would suppress their drive to breathe. So still a manifestation of COPD. Presence of barrel chest. Manifestation. Barrel chest is a hyperinflation of the chest. And we know COPDers cannot excrete carbon dioxide as a typical healthy adult can. So this, again, is a manifestation of the disease. Difficulty arousing the client. Is this a manifestation or a complication? Meaning, if I were to walk into the room of a COPDer, is it normal for them to be difficult to arouse? No, that is not normal. That is not a manifestation. This is a complication. So when I said, look to see if you have a disease, you would report the complications or the unexpected findings of that disease to the healthcare provider first, because this is not normal. We'd have to gather more data and figure out what's going on with our client. Let's look at the next topic. The nurse is caring for a 2-day post-operative cholecystectomy client. What is priority to report? Again, you have your keyword, and it says, what is priority to report? This is not, do I assess first or do I act first? We already know it's assessment data because it's saying information we're going to report to the healthcare provider. So you need to think about your topic. Your topic is a post-op 2-day cholecystectomy client, and is it a manifestation or a complication of this situation? We know it's a post-op client. So we're going to think manifestation versus complication. And if we have multiple complications, you better report what is highest priority according to Maslow's. So confusion. A 2-day post-operative client, it is not normal for them to be confused. Cholecystectomy means removal of the gallbladder, but again, this is a post-op client. This is not normal. This is a complication. Blood pressure of 74 over 56 millimeters of mercury. That is not normal. That is a complication. Pulse oximetry reading of 82% on room air. Again, this is not normal. This is a complication. And dyspnea. Should they have difficulty breathing 2 days post-operative? No. Again, not normal. So now we're looking at all complications. Manifestation versus complication didn't help get rid of an answer choice for us. Or if you want to think expected versus unexpected, didn't help. But let's start labeling it according to Maslow's. This is a D in our ABCDs. This is a change in behavior. So it is not normal to have a change in behavior, but can we act on this alone? No, we'd have to gather more data. That's why we label it D. We don't like a change in behavior. We have to keep these clients safe, make sure they don't get out of bed or things like that. But again, you'd have to gather more data to figure out exactly why they're confused. Blood pressure of 74 over 56. That is not normal. That is very low. And this is a clearly identified circulation problem. We're thinking fluid volume deficit, and we'd have to act either by giving fluids or blood products or maybe a medication that causes vasoconstriction to help improve that blood pressure. Pulse oximetry reading of 82% on room air. That is a clearly identified breathing problem. When a client's pulse oximetry level drops below 90%, we as nurses can act, and the action we can take is putting oxygen on them, okay? And then dyspnea, again, difficulty breathing is not normal for a 2-day post-operative client. So that falls into your breathing of Maslow's. So let's look at this. We would get rid of a change of behavior and a circulation problem over 2 breathing problems. But remember, you can pick one and one only, and you have to think I've kept this client the safest. So how I like to think about it in my brain, if they're having difficulty breathing, what are we most concerned about as nurses? We are most concerned that they are not getting oxygen from the outside environment into their body so their blood can transport it to their tissues. Well, this is clearly showing us already that they don't have enough oxygen in their blood. So are we going to do a risk of hypoxia, or are we going to pick a right here, right now hypoxia? Because we are proving that they don't have enough oxygen circulated in their body right now. So we go with the right here, right now versus risk of hypoxia. And we would report this. This is priority to report. And if you ever see a level that low, you can also act as a nurse by putting oxygen on them. And the last thing I want you to think about is, who do you see first? Who do you see first? You should always think manifestation versus complication. Meaning, if it is a disease, and the answer choice, is it a manifestation or complication of the disease? And then at the end, label it according to Maslow's. Because remember, we're not going to run to manifestations when we already know they're diagnosed with this disease and it is typical for certain manifestations to occur of the disease. So let's start. The client with kidney disease who has an input of 800 mLs and an output of 120 mLs in 4 hours. So topic is kidney disease. My question to you, can kidney disease influence urine output? Absolutely. That is a manifestation of the disorder, but also think about this. Even though they have a lot more in than they're putting out, are they still making adequate urine? We know as nurses, they need to be making a minimum of 30 mLs per every hour. And actually, this client is still meeting the minimal requirements because 30 mLs times 4 is 120 mLs. So we couldn't even act on this client. So categorize it as a manifestation and can you continue to move on. The client with a pneumothorax with a chest tube to wall suction. So pneumothorax is a collapsed lung. Is it appropriate for them to have a chest tube? Absolutely. That's an appropriate treatment for a collapsed lung. So is this showing any physical problems that we don't know about that's not being treated? No. This is, again, a manifestation of this disease. We already know they're diagnosed with a collapsed lung, and in this perfect world, they should be treated according to their diagnosis. And a chest tube is absolutely appropriate treatment for a pneumothorax. So categorize it as manifestation and move on. The client with diabetes who is restless and diaphoretic. So think about all the manifestation of diabetes. Elevated blood sugar, your 3 Ps, polyuria, polydipsia, polyphagia. These restless and diaphoretic are not typical symptoms of diabetes. This is a complication. And we would have to figure out why they are restless and diaphoretic. Could it be hypoglycemia? It could be. We'd have to gather more data. But again, restlessness and diaphoretic or sweating is not a manifestation of diabetes. So label it as a complication, and let's look at our last answer choice. The client diagnosed with a myocardial infarction, an MI, with elevated cardiac enzymes. So let's think about this. They're diagnosed with a heart attack, meaning we know they've had a heart attack, and in this perfect world, we're treating them appropriately for a heart attack. So my question to you is, elevated cardiac enzymes a manifestation of an MI or a complication? If they have an MI, they will have elevated cardiac enzymes. This is a manifestation of the disorder. So we wouldn't run to this. If they have an MI, they'll have elevated cardiac enzymes. Not only that day, but it will continue to be elevated even after the heart attack occurs. So again, would we run to this? No. It's a manifestation, or it is expected to occur when we have an MI. Okay? So the client you should have ran to, or you should have saw first, was the unexpected complication of restlessness and the client being diaphoretic, who is a diabetic. So I hope this has helped you. Again, really think about your nursing process. In your scenario, do you have assessment data or not? If you do not have assessment data, you need to act. Okay, I'm sorry. If you do not have assessment data, you need to assess. So remember, gather your data first and then act. Okay? And then when it comes to diseases, think manifestation versus complication, or what is unexpected versus expected of a disease. And always at the end of the day, label it according to Maslow.